Welcome back. For today's Get Healthy, we wanted to learn more about this groundbreaking new study we've been hearing about covering the treatment of breast cancer. The study suggesting that chemotherapy not necessary in most cases. Dr. Corey Donovan, a surgical oncologist with Legacy Cancer Institute, happy to have you here this afternoon because, boy, this has received so much attention in the last 48 hours.
Yeah.
What do you want us to know about this study?
Well, I want women to understand that breast cancer is not one disease, that breast cancer is almost as diverse as the women that get it. And now we are changing and tailoring our therapy to fit a woman's specific breast cancer. And this study really emphasizes that we need to bring therapies that treat women's tumors specifically. And that doesn't mean chemotherapy for everyone.
And it doesn't mean that you're not taking anything for it. So what would be
Exactly.
the alternative treatment?
Excellent. So everyone in this study got endocrine therapy, and that's starving the tumor of estrogen in one way or another, not allowing those cells to set up shop somewhere else by depriving them of one of the signaling molecules that helps them divide.
As far as what the study showed, you said the number was high as 85% of women in the study did not need chemotherapy?
So the estimate is that 85% of women diagnosed with breast cancer in the United States yearly might not need chemotherapy. And that's very exciting, that number of women for whom endocrine therapy is going to be very powerful.
This doesn't, I was going to say, this doesn't have, there's not the bad side effects. That's the big thing about chemo, right? We all are familiar with so many bad side effects.
So endocrine therapy is more targeted. It's a pill that you take every day. It's a marathon. You take it for at least 5 years. So this is, women are signing up for commitment here, but it's very powerful and it does not have the devastating side effects of chemotherapy.
Sick? The patients are getting through this much easier.
That vision that you have of somebody who's undergoing cancer therapy, that's very much associated with chemotherapy. Endocrine therapy, because it's so targeted, has some minor side effects, but most women tolerate it very well.
Doctor, my thoughts go to women hearing this who went through chemotherapy and may say to themselves, did I need it?
That is, I've already had patients ask me that. And I want to reassure them that in many cases you did. And it was an excellent way to kill the tumor cells. Chemotherapy saves lives. And there are a number of women for whom chemotherapy is still an essential part of their treatment. That's in particular women with HER2 positive cancers, women with triple negative cancers, women with high risk endocrine positive tumors, and young women. All benefit from chemotherapy and it saves lives. So that's something that's important.
Doctor, do you anticipate other providers, other doctors changing soon? I mean, or is this research that just came out, this is going to take years to really start practicing?
We've already changed practice as of Monday.
Wow.
I called patients to let them know that, that they could rest assured that chemotherapy probably wasn't going to be in their future based on the results of this test, that we could feel more confident in our decision making going forward. I think that it's important to know that we won't be drastically changing how we treat people, but that this helps us have more confidence in the way that we've been treating women.
And just to make sure, you know, women are hearing this correctly and have the right information, what about the study determined?
Great question. So what this study looked at was the oncotype results. And what is an oncotype? Well, it's where they take a small portion of the tumor and they send it off to a lab and they look at the genetic workings of the cells within the tumor, not a woman's whole body genetics, but the genetics specifically of the tumor. And they look at how busy those cells are, how dangerous are those cells, do those cells exhibit qualities that make them more threatening? And then they sort of divide them into 3 groups. Low risk tumors are women who do not need chemotherapy. Then there were the high risk tumors, and we knew that those women did need chemotherapy. The vast majority of women, unfortunately, fell into that intermediate group. And until now, we didn't know what to do. And this study shows us that it's safe to omit chemotherapy in that intermediate group because those women will be well treated with that endocrine therapy that we talked about.
So I realize it's going to be different case to case, but generally speaking, is this a faster recovery process as well, or can it be in some cases?
Oh yes, women it's a daily pill that you take and you start taking it after you've recovered from surgery and radiation. In many cases, and you take it every day and you go forward for about 5 to 10 years depending on your type of tumor.
And you did say it is widely covered by insurance.
It is, yeah.
So worth checking on.
Well, Dr. Donovan, really fascinating breakdown of this study, and we thank you so much for coming by and sharing that today. I know you're putting a lot of minds at rest out there for women who had questions, so we appreciate it.
It's been my pleasure to talk to you. Thanks.